Good afternoon. My name is Andres Mantilla. I am the director of the Department of Neighborhoods at the City of Seattle, and I want to thank everyone who is participating in this town hall for joining us this afternoon. This town hall is a collaboration with the mayor's office as well as various departments, which you will hear from later, within the City of Seattle to bring you the most current information available as it relates to both COVID-19 and safety and health. I know Mayor Durkan and the directors joining her today are eager to hear your questions related to the COVID-19 pandemic, issues around policing and the SBD budget, as well as concern over the West Seattle Bridge, updates there, and transportation impacts. We want to hear your thoughts and concerns about how we can work together to build safe and healthy communities. We will begin first with Mayor Jenny Durkan, and then continue with Seattle Police Chief Carmen Best, and then hear from Director Hayes, Patty Hayes. She is having some technical difficulties getting on, so we will adjust the agenda as needed for when she gets on. And then hear from our Fire Chief, Harold Scoggins, Seattle Human Services Director, Jason Johnson, and end with Seattle Department of Transportation Director, Sam Zimbabwe. For any media who is attending, if you wish to ask questions, please do reach out to the Mayor's Office communication staff. For residents asking questions, please type in any questions you would like to ask in the chat feature. We will do our best, and I will do my best to accommodate as many questions as I can and group like themes into one question. I'd like to take this time to remind you about the Mayor's COVID-19 resource page. This is a great page and resource for finding the latest updates from the city. So please visit the COVID-19 resource page at www.seattle.gov/mayor/COVID-19. I'm going to now pass it over to Mayor Jenny Durkan to begin her comments. Mayor.
Thank you very much, Andres. I want to thank everybody. I'm sorry that we can't be together physically and meet in a real town hall, but we're glad that we can have this format so we can have some discussion from you and questions. You're going to hear from the people in the departments who are doing the work themselves. We are just in unprecedented times in the city of Seattle and across our nation. We are facing a trilogy of challenges that have never been faced before by our city. The first being, of course, a global pandemic, COVID-19, which we were one of the first in the nation to experience, and everybody did their part in flattening the curve. But we've seen now that as businesses have reopened and people have come together again, that the numbers are getting worse. And we're going to talk more about that when Patty Hayes joins. But the governor made announcements today. We are starting to have to turn the dial back. So I will talk later, but really, really want to impress upon everyone. We need to get more vigilant about COVID-19 again. We are back in where we were at the end of March, beginning of April, in terms of the number of new cases per day. Right now, they're focused on young people, but we've seen in other states how those move quickly to vulnerable communities and senior communities. And we want to make sure that we keep people healthy and that we protect our hospitals and first-line workers. Of course, with COVID has come just an economic devastation that we've never seen in our city before. It's at crisis level for so many people. We've seen small businesses close and tens of thousands of Seattleites and workers out of work. Both the health impacts of COVID and the economic impacts of COVID have fallen disproportionately on our communities of color. More of our communities of color have experienced health consequences, and more of them are also experiencing the economic consequences. Our government has worked really hard in the city to try to get our resources together to give direct relief to people that have been hurt the most by COVID, whether it's our small businesses, our families, our immigrant and refugee communities. But we've seen in the new numbers also that the numbers continue to go up disproportionately for our communities of color, particularly our Latinx community. So we hope to get some questions. We had a roundtable today with leaders from the Latinx community to get more help in community from that. The third challenge, of course, is the civil rights reckoning that we're seeing across this nation resulting out of the murder of George Floyd, which brought to light once again the hundreds of years of systemic racism built into every institution, including how we do policing in America. And that itself has also led to broad discussions about policing and whether policing should be defunded as well as how do we make more investments in community so that communities are healthy and thriving. Chief Best and I have laid out our vision for this year's and next year's budget at Seattle Police Department. That budget is driven by the principles that yes, we can do more for community and we can reimagine policing so that when someone calls 911, they get the help they need. And sometimes that help is a police officer and you need them right away. Other times it will be a different kind of help that you need, like a mental health care worker or the like. We want to make sure that we can build up that capacity so that help can be available 24/7 in every part of our city. Chief Best and I have also made clear that we think that cuts that are too drastic will compromise community safety, and the chief will be addressing that for you. So we know that there's a lot of questions both about the pandemic, which Patty Hayes will talk about, the economic downturn, which we'll also talk about. The fire and police chiefs are here to talk about public safety. And then if it wasn't enough, West Seattle has its own special impacts with the loss of the West Seattle Bridge. In any other time, that would probably be one of the key crises we were dealing with. And we know how important it is to the West Seattle community. So we have Sam Zimbabwe here to answer your questions. Know this, even this week, I was trying at every level to find funding for a new West Seattle Bridge or reconstructed West Seattle Bridge. I talked to both of our US senators and to the governor. I declared an emergency that would help us unlock additional sources for funding and give us the opportunities and ability to make improvements more quickly. We know it's a lifeline, not just for West Seattle, but for the port and our regional economy. A lot of the development coming to the port is going to rely on having that great freight corridor. We also know the impacts that this has had on people living in West Seattle and in places like South Park as traffic is diverted. So we know there's a lot of talk about tonight. Look forward to your questions. And now I'll give you to Chief Best, our Chief of Police.
Are you ready for me? Great. Great. Thank you. Thank you, Mayor, for gathering us here today. I love West Seattle, and I always look to West Seattle for a great time when I take my daughters out to Salties. I've spent so much time in South Park walking around and speaking with people and eating at Jalisco. And really, I walked and eaten probably in every neighborhood of the city, but I really, truly enjoyed my time in West Seattle. I want to give everyone an update on policing issues in general and here in West Seattle, as well as where things stand on police reforms. First, as I hope most of you know, you have a new Southwest Precinct Captain, Captain Kevin Grossman. I know everyone had great connections with Captain Pierre Davis. He did absolutely wonderful work here, but we need to give all of our staff different opportunities. Captain Grossman is great. He has the experience and the connection to the city to build on the great work that Captain Davis has already done. And Captain Davis will continue his amazing connections and community efforts as a captain in our Collaborative Policing Bureau. Anyone who is paying attention to the news has to be aware that we are dealing with a sharp uptick in shots fired and gun violence, including homicides in the past few weeks, all across the city and in the region. This all while continuing to try to keep everyone safe during ongoing demonstrations, some of which have been particularly violent. We are actively investigating close to a dozen shootings since last Thursday, including the deaths of 4 Black men. Overall, there have been 31 homicide victims this year. Last year at this time, we had 19. Some of these are connected to ongoing retaliations and situations. Others are one-off interpersonal disputes. Our officers and detectives have made arrests or identified suspects in 17 of the homicides so far. That's a clearance rate of about almost 60%, which is good because that's for this year's homicides. Last year, overall, they cleared 72% of homicides. And all of this takes a tremendous amount of work. The national average is about 62%. And to be honest, I'm worried where cuts will leave all of these efforts. Finally, for other crime, West Seattle is doing relatively decent. Obviously, we'd love to have no crime, and we can always do better. But year to date, major crime in West Seattle is down 16%, 389 fewer incidents. Person crime is down 13%, 30 fewer incidents. There has been one homicide in West Seattle. That was in January, and that homicide has been solved. We also, as you know, found the remains of 2 victims on Alki, but that terrible incident did not occur on Alki or in West Seattle. Property crime in West Seattle is down 17% by 359 fewer incidents. Most property crime is down except for 3 additional arsons and 20 additional motor vehicle thefts, just to give you an overview of the crime situation. Now, as it relates to the broad conversations happening around the re-envisioning community safety, I and the entire SPD are committed to meaningful community-led work on how we achieve true community safety. The mayor mentioned it earlier about reimagining and re-envisioning through community how we can provide public safety to everyone who lives, works, or visits the city. It's not a new concept that officers have been asked to pick up the pieces after so many systems have failed. If those systems are better supported and managed, we will have less to do. So until that work happens, however, officers still need to be available and able to respond, to help people and to protect people. I know many of you had strong reactions to the news that our staffing levels were supposedly to be cut by 50%. We would likely not staff the Southwest Precinct. We did not reach this conclusion lightly. When we looked at the numbers of staffing we would have to cut with the large-scale layoff, the clear proposal that we had at the time anyway, there would be fewer patrol officers available for citywide responses and proportionally available to work in the Southwest Precinct at each shift. It just didn't make sense to have an entire building that would likely staff, 6 people at the most on any shift. So we would likely move those officers if we had a full 50% cut to the South Precinct, where they worked before, dispatching to the Southwest Precinct until 2003 when the Southwest Precinct was built and developed and staffed. I'm glad to see that, as we pointed out, our operational realities of our budget and staffing, it seems that we will not have this drastic cut in 2020, but that's not certain. And we don't know what 2021 holds. I have my team consistently and constantly working to figure out how we can deal with a variety of budget scenarios while it's being worked through. At the end of the day, what we really want is to make sure that everyone in Seattle has as much protection and community safety as possible. And so we're working through all those scenarios, but we will have to deal with the numbers as they are presented. My commitment is to put most of our resources into 911 response. We have to maintain our ability to quickly get to in-progress crimes, especially when they involve life safety. We are actively participating in the initial conversations around what types of calls we don't have to respond to. But if we cut officers first without a plan, we'll have to figure something out. So today, moving forward, I need to hear from community. That is why the mayor has brought these groups together, the people that you're going to hear from later, so that we can address your issues and concerns. And I know that she is absolutely wanting to hear from everybody so that the best decisions possible are being made. We want to make sure we know what community safety looks like for all of you. Broad policy and budget conversations are what happens in City Hall. I need to hear, and the mayor wants to hear, what you want to see from you, the people and the residents that we're here to serve. So thank you all for inviting me. Thank you, Mayor, for convening this meeting. And I look forward to the conversation and the discussion to follow. And that's all.
Thank you, Chief. I think we're going to go to Director Patty Hayes next to talk a little bit about updates around COVID-19 activity. Director Hayes.
Thank you. Hello, everybody. I am a West Seattle resident, so it's delightful to be with you tonight and to talk about where we are at. As the mayor said, this is unprecedented times. None of us would have imagined what it would be like to have and live through a pandemic. And we're all learning a lot. Again, what makes something a pandemic is called a novel virus. That means it's a virus that's new. It's new because we don't have any immunity to it. It's new because we have to learn what treatments work, and it's new because we don't have a vaccine. So those three things make a pandemic particularly dangerous. And we have seen throughout the last 6 months the learning that we're doing. I call it science in action, that we're translating into how we're strategizing and working with the city with our strategies for dealing with the outbreak. Currently, since the beginning of the phased approach from the governor's order, we have been expecting to see an uptick in the virus activity and the outbreak because people are around each other more now. And indeed, that's what's happening. And you'll see with this slide that's in front of you, this is the key indicators. And if you haven't looked at our dashboard, the web address for that is at the bottom of the slide. You'll find lots of information. We have a number of dashboards there. This is the one that indicates our accountabilities in terms of looking at how we're doing in this outbreak with the different measures that the governor and the Secretary of Health have established. So what we know right now is we've had an uptick in the outbreak, and we are seeing around 95 cases per average 100,000. That's the measure. What this means is that there are more and more people who are out and about. We are in our work to find out where people are getting infections. We are finding that because people are interacting with one another, there's not one reason, not one place where people are getting the virus. So we may find that somebody went to a backyard barbecue, they went out to a restaurant, they were at a church service. And so it's hard to know that there's not one place where people are getting infected. So what this means in terms of the virus is that we need to make sure that we're having everybody on board with wearing facial coverings or masks, with doing physical distancing, with doing hygiene measures of washing your hands, and staying home if you're not well. One of the things we've learned about this virus is that a person can expose people to the virus, can actually transmit the virus up to 2 days before they have symptoms. And a lot of people just have very mild symptoms. So it's a real challenge to see where this virus is going. We do know that our communities of color experience disproportionate impacts of COVID-19. And this relates to longstanding disparities for these populations. It has to do with the fact that many of them are essential workers. Many of them are in jobs where they must work for their families. So we are working with those communities to try and make sure that they get the support they need. The virus doesn't respect any certain action right now. It's looking for ways to spread. So we have a strong focus on testing with the city's great partnership, and you'll hear from Chief Scoggins about the effort. We've had with the city a wonderful partnership on testing that's made an amazing difference. We're expanding it. We are also moving more testing into the south end of the county where we know that there is higher level of the outbreak happening. We know that the younger folks right now are experiencing more of the outbreak, and that's because they're congregating. But all that means is that in a matter of time, it will go up. So right now, a majority of the outbreak is occurring in people under the age of 40, but we're already seeing an uptick in folks that are 40 and above. And with what happened in other places like Florida, Texas, Arizona, and California, we see the outbreak move from these younger populations who may not need to be hospitalized, but they certainly do infect other people. It goes to an older, above 40, and folks that have chronic conditions, et cetera, can get very ill, get hospitalized. And then, of course, like we had in the very beginning, we had the outbreak in a nursing home here. And so it's very important for us to do the contact tracing. You see that we've hired over 40 people to do that. We're bringing on about 10 additional contact tracers every week right now. And we're assisting people in what they need to do to isolate and quarantine themselves. The hospital capacity, the healthcare system needs to have the capacity to take care of folks for as this outbreak goes on. And until we get a vaccine, I wish I could tell you exactly when a vaccine is going to be available. There's a lot of hope that it will happen next year, but until that time, we need to support the community well-being and mental health while this very, very traumatizing event is happening, and while people need to continue to do the basic things, the facial coverings, physical distancing, the staying home if you're ill, and frequent hand washing or use of hand sanitizer. And I must say, as I was looking at Alki Beach last weekend, because I ride my bike up and down, I like to watch what's happening. I'm seeing a lot of people trying to physically distance, but I'm also seeing a lot of young families and families with extended family meeting in larger groups. And when they're waiting to be seated in a restaurant, I see them congregating outside. I would really ask for your partnership in this. If we're not diligent, we will have to, as the mayor said, it risks our economy, it risks our small businesses. So we really need to all participate. So I would ask you to join me in that. I always have my mask. Here's mine. I have with me today. So I'm very happy to be with here today. Happy to answer questions later. So thank you so much.
Thank you. We'll turn it over to our fire chief, Chief Scoggins. Chief.
Chief, looks like you're muted if you want to unmute, and then we'll get started.
Let's see here. How about that? Are we going there?
You're good.
Okay, good. So I'll do two brief updates this evening, and I'll say good evening to everyone. The first update I'll start with is our West Seattle fire and EMS responses. As you all know, the West Seattle Bridge has now been closed for a few months now, and many of you may be aware that since that's occurred on June 1st, we added an additional ladder truck, ladder 13, running out of Fire Station 37, which is on the southern end of West Seattle, and Medic 26, that's running out of Fire Station 26. And since we've added those units to the West Seattle response, what we're seeing is we're holding strong on our response times and our medic responses, which is those critical responses, advanced life support responses related to cardiac arrest, stroke, or respiratory issues. We've actually improved our our EMS response because those responses are there. So that's a good sign. We saw that as a need, and thank you to the mayor and the council for supporting that need, and West Seattle is benefiting from that need. So that's important. It's just been over 6 months now that we have been in this pandemic and this COVID experience. And I can remember it was on January 22nd when I sent a communication out to the Seattle Fire Department on the coronavirus, alerting the department. And as I look at the calendar today at July 23rd, and I think how far we've come on so many fronts. Many of you may know that we started our first responder testing site back in March and trying to create a pathway for first responders to get tested, so we understood if they had COVID-19 to protect them and their families and the community, so we didn't have infected firefighters responding. And then from there, we transitioned into testing people who have passed away out in the field to understand the impacts of COVID-19 there. From there, we continued and transitioned into testing in nursing homes and assisted living facilities and adult family homes to help with the community's response and partnering with Seattle King County Public Health. And it's been a great partnership over the last several months. And on June 6th, we opened up, under the guidance of the mayor, our 2 Seattle community testing sites in partnership with the University of Washington. So since June 6th, when we've opened that first site, we have tested now just over 68,000 community members for COVID-19. And what we're seeing is an infection rate of about 2.8% over the last 14 days. And you have a slide in front of you, and this is our rolling 14-day average where you can kind of see what's been happening and the number of tests per day. Between these 2 sites, we're averaging over 2,000 tests a day at these sites. And what the map shows on the right there, it shows the hot spots that we're paying attention to. And you know, this information is in public health's hand, but it's also in our first responders' hand. So if our first responders are out there and they know the hot spots, they can prepare accordingly. So as we go forward, you know, I want to continue to echo what Director Hayes said, and, you know, focus on wearing our mask and washing our hands and keeping our physical distancing, because that's going to be important as we go forward. And I'll stop right there.
Thank you, Chief. We're going to turn it over now to Jason Johnson from Human Services Department. Jason.
Andres, thank you. And hello to my West Seattle neighbors. My name is Jason Johnson, and it's my honor to serve as the Director of the Human Services Department. HSD's mission is to ensure that individuals, families, and communities are safe, healthy, and have their basic needs met. We do this with racial equity as our foundational value. And this evening, I wanted to provide 2 quick updates on behalf of the dedicated mission-aligned employees of the Human Services Department. First, on the city's work to address homelessness. The city has created and continues to maintain safer shelter spaces throughout the COVID-19 pandemic. We created 380 new beds, pardon me, to redistribute people from high-density congregate shelters to spaces at Seattle Center, both at the Exhibition Hall and Fisher Pavilion, and at Parks Community Centers at the Southwest Teen Life Center, Garfield Community Center, Miller Community Center, and through the use of hotels. The city opened 95 new tiny house village units, as well as some enhanced shelter units. We did this all in strong partnership with public health, and did this in alignment with public health and CDC guidance. We also did this in partnership with King County Department of Community and Human Services, and of course in partnership with many community-based organizations. As a result, COVID-19 transmission has been flat at city-funded shelter programs, even while we see increases in the general population. Robust testing is in place at shelters, hygiene centers, day centers, permanent supportive housing buildings, and other homeless service sites. The Human Services Department will continue to monitor the spread of COVID-19, and we have isolation, quarantine, and recovery site capacity available if conditions change. Next, I wanted to offer an update about our youth and family safety portfolio. The Human Services Department invests over $18 million annually to promote family support, youth development, employment, and safety programs. We focus our services on community-based programs and projects that drive positive results for Black, Indigenous, Latinx, and other communities of color in Seattle. We can only do this because of the partnerships that we have with community-based organizations, nonprofit agencies, and their leaders, and with other city departments. But I believe most importantly, because of the strong commitment of HSD staff. In 2019, HSD released a safety RFP. Activities funded through this RFP focused on 18 to 24-year-olds harmed by the criminal legal system in Seattle. As a result of the RFP, along with other related contracts, HSD is investing over $6 million in youth safety this year. Some highlights from our safety investments are a commitment of $300,000 in 2020 toward a community critical incident response program to prevent and de-escalate potential incidences. In communication with Seattle Police Department regarding when and where incidences occur, the designated community-based agency will immediately activate 2 hospitals and potential hotspots to calm tensions. They'll also coordinate with community leaders who can regularly follow up with families of victims and perpetrators and leverage communities' knowledge about ongoing conflicts. Community critical incident response priority population is youth or young adults who are gang involved in the criminal legal system or involved in incidents of community violence. Community Passageways is the community-based organization that is contracted to do this work. We also funded a youth consortium. This is a program that introduces youth and young adults 15 to 25 to civic engagement. By investing in youth through this program, HSD expects to prevent community crime by empowering youth and young adults to work together in a youth-led leadership program that reduces criminal legal system involvement through civic engagement and the promotion of system change for issues that matter to young people. 3 African-American-led community-based agencies are contracted to lead this work: Create Justice, Rainier Beach Action Coalition, and Community Passageways. The third is a program that I wanted to highlight is Reentry, Rerouting, Indigenous Community Healing. In partnership with the Seattle Office for Civil Rights, we are investing in 2 Native community-led organizations to provide Native or Indigenous specific community healing practices for individuals re-entering community from prison. $250,000 was made available starting this month and through December of 2022. Chief Seattle Club is the contracted provider, and we're really excited about these investments in community safety. HSD is hard at work to support the city's most vulnerable communities. This is especially critical during the COVID pandemic. I want to say that we are available if you have any questions, or more importantly, if you need help. We have a lot of information on our website, seattle.gov/human services. Thanks for your time.
Thank you, Jason. I'll turn it over to SDOT Director Sam Zimbabwe. Sam.
Good evening, everybody. Thanks for having me, and I know we're running a little bit behind and we want to get to questions and answers, and I will do my best to get us there as quickly as possible while still giving really important updates. So first and foremost is the West Seattle Bridge and our work to restore the critical traffic connection between West Seattle and the rest of the region. Just like Directors Johnson and Hayes, I am also a West Seattle resident, so I experience the impacts of this daily as well. This week, if you have been to see the bridge, you saw 2 out of 4 work platforms installed, and this will allow contractors to work on the stabilization of the bridge and arrest the continued degradation of the bridge. We will have 2 more of those work platforms assembled and installed next week, weather permitting. One of the things that we did over the course of this spring was to install instrumentation, very finely tuned instruments to gather information about the bridge. Over the course of the spring, we were able to use those as we raised those work platforms in place and get new information about how the bridge responded to additional loading. And that really helps us understand what is possible in terms of repair and replacement options. We talked yesterday with our community task force about the cost benefit analysis that is underway to assess all of the different pathways for repair or replacement. One of the critical things that we've been able to determine based on our evaluation to date is that we think that a repair option could get us potentially a little bit more lifespan on the bridge than we had previously thought. We previously thought that was about in the 10, the best we could hope for was about 10 more years of life. We now think that that's, given the condition of the bridge and what we've been able to understand, that that is at least 15 years of life could be gotten back into the bridge with the various repair options that are in place. At the same time, we're moving forward on all the options simultaneously. So we've also been selecting working to select a design team that would design an ultimate replacement if we go in that path. And that replacement still has multiple options, from a more limited replacement of just the 3 center spans of the bridge to a full replacement of the connection between the existing viaduct structures on both sides, to even exploring tunnel options. We know that the low bridge remains a critical transportation pathway for freight, emergency vehicles, and transit. We've restricted during the daytime hours all access to that. We did open up access to all vehicles overnight from 9 p.m. to 5 a.m. every day. And then we've also made some updates that will enable employer shuttles, some of the workers on Harbor Island and Terminal 5 access that. We also expect to extend photo enforcement of that policy sometime this fall, and that will enable us to really get a sense of how the bridge is being used and see if we can make additional expansions to the access policy. The last piece that I'll talk about is the Reconnect West Seattle effort to look at mitigations while the high bridge is closed. And we've already seen, even during our lower travel demand during the pandemic, the increase in traffic in communities on both sides of the Duwamish that have been affected, in South Park, Georgetown, and in West Seattle. It's really critical for us to get involvement. We had mailers hit people's mailboxes this week. More information can be found at the website here, www.seattle.gov/reconnectwestseattle. This is an effort for us to look at what near-term investments we can make that help mitigate the impacts that we've already started to see, and we know will come as people need to travel more while the high bridge is closed. I want to point people to some virtual office hours, and really one of the really challenging things about managing through this infrastructure crisis at the same time as we have our health crisis is being able to engage with community in ways that really get feedback. And I know this is one way, but we wanted to try out some virtual office hours. So next Wednesday from 12 to 1 and next Thursday from 6:30 to 7:30, we want to make ourselves available to hear what people think about our ideas for mitigating travel, and then what experiences you're already starting to face and experience about how to get to and from West Seattle. Getting traffic back on the high bridge is critical. There's no way to replace the 100,000 or so trips a day that were taking the high bridge before we had to close it at the end of March. There's really no way to replace that. There's no single way. It's going to be all of the above, and it's going to take a real community effort. That means that everybody who can find other ways, we want to help support that. Because we know that there's a lot of people who have really no other options but to drive. You know, if you have a job on the east side of Lake Washington, it's going to be really hard for you to find another way to get back and forth there. If you have a job in downtown, we might be able to make connections that make you comfortable enough to bike back and forth. So looking at all of the above solutions, working with our transit partners and others, and this Reconnect West Seattle effort is a way to gather the community feedback that we also need to prioritize to prioritize our investments over the course of the closure of the High Bridge. I'll also point folks to the website that we have stood up for information on the whole of the project, and that's www.seattle.gov/West Seattle Bridge. And I think I'll turn it back over to Andres.
Thank you, Sam. We're going to go into our question and answer period. And again, please use the chat box to list your questions, and we'll try to get to them or group them in similar themes. The first question, Mayor, is as we don't quite know when the end of COVID-19 is going to happen, how does the city plan on maintaining or sustaining support for basic needs for residents and for businesses? And in the space, there's a question here about in the space where neighborhoods or communities are lifting up their own mutual aid, how can the city support those efforts in a sustainable way?
A really good question. I will tell you that the city will not be able to sustain it by itself. But we are doing everything we can to work with both our federal partners, our state partners, and with philanthropic and others in the external of government. This week, I talked to the governor about that very issue, about how we make sure that the state can provide as much support as it can and protections for people, including making sure that, in Seattle, we will continue our prohibition of evictions probably through the end of the year. We have to finalize that in connection with the governor and with city council. We're also looking at mortgage relief for people who are, own a home or own rental homes or affordable housing, so that we can make sure that as people stay in place and don't become homeless, we also have mortgage relief there. The Congress, we believe, will give additional aid this year and then additional aid next year. We're hoping that there is an infrastructure bill so that we can get some money for the West Seattle Bridge. But the direct support is going to have to continue from the federal and state governments as well. We need them to providing direct relief for unemployment. I think that the paycheck protection that Congresswoman Jayapal has proposed is really a way to go, so that people can stay employed and small businesses know that they can have employees, and it gives that incentive to people connected to work as well as their health care. But we're going to have to rely, we will continue to use our resources. This year, we've given hundreds of millions of dollars in direct aid by converting some of the funding we got from Congress. We are fortunate. We saw early that this was going to be a significant problem because we were one of the first places hit. So we lobbied very hard, our U.S. senators and our Congress delegation, to have Seattle included in a list of cities that would get direct aid, and we were successful. So we've been able to give, grocery vouchers and rental assistance and small business assistance, and we will continue to do that as much as possible. But we have a $300 million shortfall in our city budget this year, and we expect that we will have at least a $300 million shortfall next year. As we convert as much as we can to direct aid and support, that means that we at the city have to change the way that we do business. We want to make sure that we continue to invest in those things, that when we come out of this, we will come back stronger and more equitable, and that we don't just cut in ways that aren't productive and that hurt community.
This question for the mayor and for Chief Best, and you both addressed it in your comments, but obviously a lot of feedback and conversation with communities related to the movement for Black Lives Matter movement. What other kind of cities are you all looking to for examples of how to reform SPD or demilitarize SPD that have worked across the country?
So I'm going to let the chief address that in more detail, because she serves in the leadership of some of the leading law enforcement organizations. I will tell you that I've been speaking with mayors across the country, and there is nobody who has done this right. And in fact, in most ways, Seattle Police Department is far ahead of all the other police departments in the nation in both reforms like de-escalation and training, but also in looking at ways that we can have a more public health harm reduction model. As you know, the Seattle Police Department has crisis intervention training and mental health professionals in the Seattle Police Department, and that has been very successful. They've worked closely with the Seattle Fire Department on its Health One to have a non-police response. We're also looking at a whole range of things. So we're talking to mayors and chiefs throughout the country because we know that not only should there be a new way for policing, but the community has to lead the way. And so the conversations we're having and will continue to have in deep engagement with community is, what are those things the community needs most? Who can deliver those services? And how do we build a system in place so that that community-based wellness and that community-based harm reduction model can come from community, be guided by community, and augment the need for our traditional police force? Chief Best, maybe you can add on anything you've seen nationwide as models we can look to.
Great, thank you, Mayor. You really have answered this just as I would have for the most part, because as you mentioned, I'm on a number of national and international committees with the International Association of Chiefs of Police and with the Major City Chiefs Association. So these discussions come up often, but actually Seattle is where most places look to get the answer on reforms. Many of the reforms that are being called for nationwide, we've already implemented. As you know, we've been almost a decade into the reform process. De-escalation training, crisis intervention training. Crisis intervention has recently added autism training, 5 times more training each year for all of our officers. Implicit bias training that included race to power of illusion, lessons learned from the Holocaust, partnership that we have with Northwest African American Museum. So on the front of doing reforms, federally mandated reforms, we actually lead the way, and many places come to Seattle to figure out and to learn how to do and implement these particular things. That said, we also know that we really need to look to community even more to have that real-time engagement, as you mentioned, Mayor, for the re-envisioning and the reimagining how we can do policing. I mentioned it in my prepared comments that we know that there are a number of things that officers respond to that might be better responded to by other organizations. However, we're available 24 hours a day, 7 days a week. So at 2 in the morning, if somebody's in crisis in the middle of the street, the people that they call 911 and officers respond. If another system is available for people to get that level of service, certainly we would support that. We support what the community needs and wants, but it needs to be community-led, as you mentioned. Additionally, we recently had a whole series of demonstrations. There was a lot of people viewing the fact that less lethal munitions were used. We got some criticism for that. We own it. So in the process of that, we went to the Center for Policing Equity, run by Phil Goff, to do a review and provide recommendations on how we might do that better. I also was part of the International Association of Chiefs of Police. They convened a group of international cities to come together and talk about how they're dealing with crowd management, from France to England to Scandinavian areas as well, to look at Canada, to look at how major cities, no matter where they are in the world, how they address these particular issues with crowd management, particularly when small groups embed themselves into the larger group and wreak some havoc. And that discussion will continue with even more cities across the country. So we always are looking at improving. We're always looking at continuous innovation, continuous improvement. And that's really a part of the iterative process of reform. A reform just doesn't start and end on a dime. It's a continuous process as we evolve and move forward. And Seattle, of course, has been looked at across the country as a leader, and still is looked at as a leader, even with our current set of challenges that we're working through. So I look forward to hearing, as we re-envision and reimagine policing, what the community has to say and how they want to lead this effort for their own engagement in their public safety.
Can I add something to Andres?
Yeah, go ahead, Mayor.
I just want to add that the question was, what are other departments doing? I will tell you that one of the things I'm most inspired about is we can look right here at home. and organizations that we already work with at the city, Choose 180, Rainier Beach, A Beautiful Place for Youth, Community Passageways, the LEAD program, all of them teach us different things about how we can respond differently and provide a harm reduction model and go upstream at the root causes of some of the things that end up in the criminal justice system that shouldn't. So we will continue to have engagement with other cities to see what they're doing that might be working that we're not doing. But I also think that a lot of the answers we need are right here at home in those community groups and organizations who have been doing the work. And now we have to learn how we can scale that work and have it respond in a way that 24/7 it's available to provide the services to community. That will only happen with just increased investment. And one of the things I've committed to is in new investments of $100 million into the Black community and BIPOC community, so that we can start investing in those things that build the community resilience, so people have to call 911 less. A healthy community, a community safety, really is not reliant on who answers when you dial 911. True community safety, I think, comes from having healthy communities based on your healthcare, good education, economic opportunity, housing, and the like. And so we're looking at all of those things as we talk about community safety.
Thanks, Mayor. To follow up on that question for both you and the chief, there's some questions around all of these requests coming in for immediate action, some for more deliberative process. What does the timeline look like for this as it relates to both the 2020 process for the budget and the 2021-2022 budget process?
So that's a great question. We are going to be doing the 2020 balancing packages downstairs in the city council, and they're deliberating right now. But over the next month or so, we are going to have extended community engagement, both on what does the police budget and the overall budget look like, as well as what do we want policing to be. We'll have a separate engagement on how those community investments we discussed should look, and what community believes where those investments should be that will be community driven. So we're going to have additional engagement, and West Seattle will be coming to you to make sure that we hear from people and they understand where their dollars are going, particularly in the police budget, and what part of that police budget that we hear from community that they'd like to see reduced and reinvested in community.
And if I can add to that, we certainly support any of that reinvestment in community-based services that really help protect community safety. I think there's an intersection between public health and public safety and the ability for people to feel safe in their neighborhoods. That said, I would strongly encourage to have a plan to build around so that there's not a gap in services to people who really and truly need the services provided through either public health or public safety.
Mayor, another question around this is, you outlined specific proposals right now as to what's on the table for defunding the police department in 2021?
The chief and I had a press conference last week where we laid out some of the initial things that we wanted to do to reduce the police budget. And some of those will be what they call budget neutral. It won't be a cut in the sense that that money's freed up for investment, and others won't. But there's two parts to reimagining policing. One of the most important parts is what we've been talking about, which is what functions need to be done by law enforcement and sworn law enforcement. And as we look at the police department, the chief has really led the way in looking at her department and saying some of these functions don't necessarily have to live in a police department. And by having them outside a police department, it reflects the values that we want. So for example, the 911 call center, if that's going to be what we use for any kind of help that comes to your door, that is already civilian staffed and doesn't necessarily need to be in the police department. Same with parking enforcement. Sam Zimbabwe, who was on the call here at Seattle Department of Transportation, that doesn't have to be a police function. It can move to the Seattle Department of Transportation. So we've outlined a number of specific things that we would move, in addition to some of the budget reductions that we would make that would free up money. Our final package won't be done until about the end of August. That's why we're going to be doing more engagement. That's when we send it to the City Council at the beginning of September. So there's still time for us to hear from you and to talk about the 2021 budget. I want to emphasize what the chief said, though. We are not looking for a target number. And I know that there's many people who believe that we should commit to defunding the Seattle Police Department by 50%. We're not looking at a fraction or a number. We're really looking at what is it that Seattle Police Department needs to be doing and how much does that take to fund that? And part of that component is we will not make any suggested changes without a plan and without making sure that we can provide for the necessary community safety. And I want to, again, I rely heavily on the chief, who's, you know, her 30-year plus career at the Seattle Police Department. She knows how every part of that department functions. I'm going to really rely on her to reimagine this, but we will have an open conversation with community. I'll say one last thing on this. I have said it before, and I believe that if you put community members at one table and police officers at another table, and you said, what are 3 functions that you think police do now that they shouldn't do? Those lists probably would be very similar. For example, the Seattle Police Department responded to almost 17,000 crisis calls last year. 17,000 crisis calls. If we had a way to go upstream so that those people did not need to call 911 for any reason, that would reduce the number. And we don't always have to send a police officer. I'm so happy to have Chief Scoggins here because we launched last year a project called Health One, so that when someone calls 911, if there's somebody who's in crisis and there's no crime involved, we don't have to dispatch a police officer like we were doing before. Because when police roll up, they had only 2 options really. Either arrest someone and take them to jail or take them to Harborview Hospital. We can do better than that. And so Chief Scoggins and the fire department devised Health One. And now instead of police rolling, we've got an aid car that rolls with a trained medic and a social worker. And we can spend the time we need to see what kind of help that person needs. We're going to be increasing and scaling up that kind of program, but I think that's the kind of health-based response we can do. But as the chief said, you have to have a plan in place and you have to have the resources so that you really do protect community safety at large.
Thanks, Mayor. The next question is about, as we are seeing more people stay at home, what is the city prepared to do related to rising cases of potentially domestic violence or sexual assault? And have we seen that to be the case in terms of the calls into SPD or any of the services that maybe HSD provides?
It's such an important question, particularly as we're looking now that we're in this for at least 6 more months and maybe longer than that. We could be about this time next year when we start to emerge from COVID. And the chief and I, literally in the first week of COVID, knew that this might be an issue. I'm going to let the chief address the things that the department has done and what we're seeing now. But I want to emphasize to anyone on this call or anyone you know, if there is an issue with domestic violence, they absolutely should call 911 because we have resources in place. We're working with very well-known community-based organizations and women's groups who have expertise in this. Chief, why don't you tell a little bit about what the resources we have and what we've seen on the front for domestic violence?
Great, thank you, Mayor. Yeah, so initially I can tell you that when the COVID-19 pandemic first affected our area, we saw a large spike in domestic violence cases, and we immediately joined in with our many stakeholders and partners in the domestic violence community. We put all that information up. I don't have it right in front of me at this moment, but we put all that information up, who to contact and how we were partnering on our website to make sure that people knew, and did a major education campaign about the uptick in domestic violence. We have a number of victim advocates who are employed with the department, who made sure they were doing additional outreach. Because people were confined at home, we gave officers different cards, hotel places, so that we could transport from the field people to, particularly usually women and children, but not always, to shelters, to hotel rooms and other places to make sure that there was a consistent 24-hour day, 7-day-a-week response for domestic violence victims. And again, working very closely with our domestic violence community-based organizations. Additionally, with our KSARC and the King County Sexual Assault Association as well, to make sure that we had additional outreach there. And we found that it has tapered off from the pretty significant spike that we saw at the beginning of the pandemic. We're still keeping a close eye on it at this time, but we feel like that initial education campaign, making people aware, has really helped, because a lot of our first people who are the first reporters, I would say, because school was out and we weren't getting some of those same reports from other organizations, it really made it important that we were doing that additional outreach in other venues.
Thank you, Chief. I want to turn to questions around the West Seattle Bridge now. Maybe for the mayor or for Director Zimbabwe, the impact and closure of the West Seattle Bridge on surrounding streets in Highland Park and South Park and other areas. And then a question about what does this all mean for the lower bridge in terms of the volume? When can it be open or reopened for broader traffic?
Sure, I can start off on that, and we recognize that there are streets and parts of the city that have already seen increases in traffic from pre-COVID levels around the West Seattle High Bridge closure, and those are West Marginal Way, parts of South Park, parts of Highland Park. We've done things like installing the new signal at Highland Parkway and Holden. We've made some channelization, some roadway configuration changes along parts of West Marginal Way, and we'll continue to do those types of things. The Reconnect West Seattle effort is in part intended to highlight those things that we can do quickly and effectively, but within a constrained environment, and trying to prioritize just what those investments and changes we can make and what will be most effective and most appreciated by the community. So I really encourage folks to participate in that effort. The Low Bridge, I spoke about it a little bit earlier, but it's a 2-lane road that is also is not in perfect infrastructure shape, and we're doing everything we can to make sure we don't have any problems with the Low Bridge, but we need to make sure we're conserving that resource for emergency access, public transportation, and freight to move the most possible people and goods that we have. So we looked at how people are using it, and we opened up travel for everybody from 9 p.m. to 5 a.m. We recognize that's not when a lot of folks are traveling there, but that's when we can do that and still enable our emergency responders to get back and forth. It's something that we continue to evaluate. If we opened it up for everybody to access all the time, nobody would be able to access it because there would be too much demand, and we would overwhelm the system. We would impact our emergency response. We would impact all those folks on transit, both now and in the future. I also do want to say, I know I sort of glossed over a few of the things that we continue to do around some of the transportation mitigations. We will be making some improvements on Sylvan Way in the near future in direct response to requests from the community, and we also are going to be installing a left turn signal on 16th and Holden. Those small scale improvements, which we know are problems that are that folks are facing. We're trying to make every possible improvement as quickly as we can to mitigate all the impacts we know folks are already feeling.
Thank you, Sam. Mayor, the next question is about schools and schools related programs. We just heard the superintendent make a recommendation to go online for the fall. What is the city doing to work with the school around childcare programs or after school programs for folks that need those services?
Such a great question. And I tell you, this has been jolting for parents and families. And I will say that I don't think there's any school district in the country that got it right in this first stage of COVID. And we saw in the Seattle particularly, I'm very concerned about our communities of color in particular. So we're having conversations with Seattle Public Schools in that regard, and 3 different things. Number one, so many of our kids are on free and reduced lunch. We have to have a systematic way to make sure that we keep that food program going for those kids and those families. Number 2, going online is much easier for some families than other families, and it's put a particular burden on communities of color and disadvantaged communities. So we've talked to the superintendent of Seattle Public Schools and said, we want to help you make sure that you've identified every one of your kids to make sure that they not only have access to the internet, but they have a device that can be connected. And then what is the plan to help support and mentor those kids? I know from my own experience that my kids outpaced my ability to help them in school about the time they were in 6th grade. So we have to have extra help for our kids and our students. There's no question about it. And 3 is childcare. There's so many parents, particularly working parents who are essential workers, who count on kids being in school. And if they don't have daycare, they may not be able to go to work, and then they miss a paycheck. So we stood up emergency daycare last year for essential workers and others. We're going to work with Seattle Public Schools to make sure that they can step into that gap in a more profound way. We're asking everybody to do more. We know this is asking our teachers and our schools to do things that are different than how education has been before. But we're in this. Most employers in downtown Seattle have already said that they're going to be working from home at least through the end of this year. And we think with the way that COVID's going, it could be into next year. We've got to get in a marathon stance right now. But if we're going to, don't want our kids falling further behind, particularly our kids of color, we have to do all we can. And so the city of Seattle has an education levy. We're looking at how we can reprioritize money within that levy and make sure we leverage it to really help on those priorities for our Seattle Public Schools.
Thank you, Mayor. I want to turn it right back to you because I think we're right about at time here for any closing thoughts.
So I want to thank everyone who's here. Any one of these topics could have been an entire town hall, and I recognize that there's many of you who did not get your questions answered. We want to find ways to continue to talk with you and engage with you. And I know that these are incredibly difficult times. I want to emphasize a couple things. Patty Hayes said it well, but COVID is here and it's back, and it's almost as bad as it was in late March, early April. All of us have got to redouble our efforts. I know in this nice weather, it's hard not to go outside, to be with friends, to be with family. We broke apart so many of the social bonds, and all of us, I think, have gotten a little more lax. I know I have in some ways. And so we have to really be stringent and know that we're in this fight and we're in it for a long time. And so not having those social gatherings, really washing your hands and wearing a mask. Wearing a mask when you're in public protects you and protects others. If we all do these steps together as a community, I think that we can come through this better and stronger. But we're going to be in it for a long time, and the economic consequences to our city and to our communities and our families and our workers will continue to be really hard. The city and I will continue to listen, to hear what you need, to do all the best that what we can't do. We're going to be working really hard with our state and federal and county partners. So together we can really provide the assistance that people need to make it through this hard time. We know this economic downturn has been so hard on so many people, and we are doing all we can to see what we can do at the city, but also making sure that if there's ideas out there that the Congress and the federal government or the state should be doing, we're going to put pressure on. And so far, we have been able to work very well with all 3. We've gotten more federal aid than most cities in the country and more than probably any in the state. So we know it's been really hard. We also know, and I tell you that the civil rights reckoning that we are experiencing in a nation is a generational challenge, but it's one of the greatest opportunities in my lifetime to really rectify the issues that we've not been willing to address as a nation. And I think it starts with an acknowledgement and an apology as a nation to really acknowledge what institutional racism has meant to our country since the time of slavery and how it has embedded itself in every institution we have. And it has led to so many of the disparities that we see today in the economy, in public health, in what's happened in COVID-19. And so we have an obligation to do all we can. And it is a difficult and tumultuous time. You have my commitment. We will look at policing to see how we can reimagine it, to make sure that it works for communities and that the interventions that government has are positive ones, that we invest in those parts of community that make it healthy. You also have my commitment that I will do all I can to make sure that we can commit resources to community in a way we haven't done before, to really recognize and mitigate against all of the harms for generations. Our nation, and I think our city, has an obligation to do what's called reparations, to really acknowledge the harms that's been done and to try to make a community whole. We did that for Japanese Americans, recognized the harm we did. We could never make them whole for the harms we did. And we have to recognize we can't make people whole, but it's time we own up to our own omissions and commissions that have led to a system that has been unfair in every part of government. And so while I know that this is a passionate and heated time and that people passionately disagree on some issues, I hope we can agree that we can't be the city that we hold ourselves out to be if we're not really to do the hard work to make ourselves uncomfortable, but to also find paths to move forward, to make generational change, not momentary change. And so you have my commitment as mayor that I'll do that. And I know that all the people you heard from today on this phone who touch any part of that are as deeply committed, as is almost every city worker that I've talked to. This has profoundly impacted everyone. We are in an unprecedented time, so unprecedented, the word unprecedented doesn't seem to capture it. But we've never faced these challenges ever together. And cities feel it first. A pandemic, an economic crisis, a civil rights uprising, and on top of that, you in West Seattle are dealing with the bridge and the lack of mobility. So together, we won't be able to prove or we won't, as a city, undo generations of systemic racism, but I think we have the obligation to do what we can. And so I look forward to hearing more from people, to having those discussions, to moving forward, and to do it in a way that we don't just make the community safe and better today, but we're thinking about what it's like for our kids and our grandkids. And I appreciate all of you being here. I know there's many places you could be on this beautiful summer night, and we look forward to engaging with you more. Take care, everybody. Wash your hands, wear a mask, stay 6 feet from people, and please, please, please do your part. We're in COVID for a long time, and it's going to get more serious again. We've seen it in other parts of the country, and we need to double down again in Seattle to show that we can care for each other in every way. And I believe we can. So thanks very much and have a good night.
Thank you, Mayor. The questions here for folks that weren't able to get an answer to the questions, you can please email jenny.durkan@seattle.gov. And also, as you noticed here, this session has been recorded or is being recorded and will be available on Seattle Channel and over social media in the coming days. So thank you very much and good evening.